I want to ask you this question. Why the crave for this lightening or bleaching? Why is it that we have not been able to address it?
Well, I think it's because being lighter skinned still has benefits. I always
Mm,
tell people that, in almost everything in our environment, you follow the money. There are
mm,
still social and economic advantages of being light skinned. So as long as people, identify and realize that lighter skin can get them some, an edge socially in terms of relationships, marital and economically in terms of job opportunities and people will continue to lighten their skin. And the unfortunate truth is that these still remain. So if we can eliminate those they are the socioeconomic advantage of being light skinned, and people begin to realize that no matter what color you are, you have the same opportunities economically, the same opportunities socially, then it will stop. So part
mm,
of the solution is actually the men. A lot of men are, tend to insinuate that lighter women are more attractive, they're more beautiful. That's one. Another thing is that there are studies that show that people who are lighter tend to get more likely to be employed than a dark
mm,
skin. If a light skin and a dark skin person are going for the same interview, have the same qualifications and all that, particularly if it's a job opportunity that requires them to be, in front of people. There are studies that show that the light skinned person would most likely get the job. In America, they did a study on colorism and showed that people who are lighter skinned, who committed crimes, women, they had shorter jail sentences just based off the color of their skin. So there's a wonderful doctor of mine, doctor no, a wonderful doctor I know who is on Twitter. She talks a lot about it to Dr. Brown, Dr. Ola Brown of Nigeria Flying Doctor. She had an article out that showed that the socioeconomic advantages of lighter skin is what is driving, this craze. And we need to, deal with it from the roots. Because if we keep telling people don't bleach your skin, it's bad for your health, it's bad for this, it's not good for that. But people who are light skin are still seen as, more beautiful, more attractive, more, they have more advantages social economically. It will be difficult for you to tell people to not lighten their skin. A lot of men show that they prefer lighter skinned women, and a lot of women, do this
mm.
because they are looking for prospects, and of course, that is one thing that really drives it. So we really, really need to look at it from a cultural and a perspective first. Because yes, we
Mm.
tell people not to lighten their skin, but if there are advantages to it, they're not going to listen to us.
Yeah,
Sadly,
yeah.
and unfortunately, a lot of the things people use to lighten their skin, they are dangerous, they are harmful. But people are ready to take that risk because of the benefits that they perceive that they can gain from skin lightening. And then now it's becoming conditioned. So you have young people growing up believing that that's the way they should go about it. And that's why you have a lot of young mothers now looking for skin lightening creams for even their children. And
Mm,
for a mother to do that for their child, mothers are always, they believe they want the best for their child. So for a mother to decide that she wants to lighten her child's skin, she believes that that's a good thing she's doing for her child. There's no mother, or there are very few mothers that would willingly harm their child. So there's a lot of ignorance. They actually, for a mother to be using this for their child, they don't know that they don't. It means they don't know the repercussions, or the side effects or the adverse effects that can come with using these creams to lighten their skin. And that's because the media or the people selling these products are not being truthful about them, you know.
yeah, yeah.
And we really need to work on that. So it's a really big problem, particularly as one of my colleagues, Dr. Gold, she had a video today and she spoke about the fact that now you people are targeting children and it's not acceptable at all because of the health and the adverse health effects of skin lightening. Some people say as an adult, you have a right to choose if people want to lighten their skin, yes, we need to give them an informed, we need to give them, allow them to make an informed choice. You can't force somebody not to lighten their skin. It's their decision. But as doctors, it is our duty to educate them about the side effects of skin lightening and hopefully help them
Thank
to
you, Ma.
understand that
For
it is not good.
you spoke about the area of ignorance about parents, women, ladies not knowing that these creams are harmful. So what I want to ask right now would be, for someone listening to us, she has a cream and she doesn't even know what to look out for. Okay, so why should this cream be bad for me? Why shouldn't I use it? What would you advise? What are those chemicals? What are those substances that when you see them in your cream, you are supposed to run away? They shouldn't even be on your skin at all.
Okay, so this is very difficult, and I'll explain why. In
Okay.
Nigeria, a lot of people produce creams and don't actually disclose the contents. There are many studies that have shown that even creams that do not have, they do not disclose on the label that they contain dangerous substances like mercury, like high levels of hydroquinone or corticosteroids. These substances are the top three things that are used for skin lightening in our environment. And you find many people, many creams that actually have these substances, they are not being disclosed. The people who create them do not disclose on the labels that these substances are present in the creams. And that is a major problem because people will go out buying a skincare product thinking, oh, it's safe or it doesn't have any lightening agents, and they use them. And unfortunately, they end up using something that has a dangerous product. So let me talk about the three major things that are used for skin lightening in the environment and why we advise people not to use them. The first one is hydroquinone. Hydroquinone is actually used by dermatologists in some parts of the world. In some areas, it's banned, like in Europe. But in America, in Asia, and in Africa, it's allowed in small quantities. Hydroquinone is is a very effective skin lightening agent, but it's not meant to be used for long periods of time, and it's not meant to be used without a prescription. So it's like a prescription medicine. And prescription medicines are usually used for short periods of time. Maybe the doctor would say use it for 6 weeks or 8 weeks and stop. And it's not for the whole body. It's usually used to treat a particular skin lightening issue. But in our environment, we have people using it, they use it for long periods of time. And then it can come with a lot of side effects and also at very high strengths or high concentrations. And this is unacceptable. So that's one thing. So hydroquinone, and then it can cause this very horrible, ugly discoloration of the skin when it's used for long periods of time, particularly without sunscreen in an environment like Nigeria where we have very high UV intensity. The sun is very hot. So people will rub hydroquinone all over their body without sunscreen and go out into the hot sun. It's ridiculous. Now, the other thing is steroids. And these steroids, corticosteroid, this is the major thing that we believe a lot of these so-called organic creams are using. They contain these corticosteroids or topical steroids. Steroids, as you know, as a doctor, they are used to treat inflammation of the skin for a short period of time. We may use a steroid for just a week or two and stop. And that's because long-term use of steroids will damage the skin, will cause the skin to become thin, will cause the skin to develop, become very transparent. So that's when you see people saying they have green veins. It causes skin thinning. It can reduce the skin's ability to fight infection. So any fungal or bacterial infection that comes on the skin will become exaggerated because the skin's natural immunity has been suppressed by the steroid. It can also cause stretch marks. So you have stretch marks like that, and so many other things. Then steroids are also absorbed into the bloodstream through the skin. And a lot of steroid use can actually result in high blood sugar, high blood pressure, and what we call Cushing syndrome, which is an excess of a hormone called cortisol. exogenous cortisol or excess of cortisol in the body, which can lead to a myriad of problems: weight gain, depression, high blood sugar, as you mentioned, high blood pressure, and so many other terrible things. And we've actually seen people developing Cushing syndrome from using Demovate cream, which is a very potent steroid. Now, a lot of these organic creams that are so-called organic, because there's nothing organic about them, contain these steroids, because when people use them, after 3-4 months, they start developing the side effects of steroid use. And that shows that because of the lightening effect of steroids are not primarily used for skin lightening, but the side effect because they inhibit the melanocytes. So the melanocytes, that's the cells that produce the color of the skin. They have a way of preventing them from producing melanin. But it's a side effect. It's not the real effect of the steroid. So a lot of these creams contain these steroids. And a lot of people mix steroids into their cream. A lot of people even mix for their children. They will buy from Bact A, Skinil, and a lot of steroid-containing triple action creams to mix with their baby's cream, because they realize that the cream can make their children lighter. It will also initially make the skin very smooth because it's an anti-inflammatory cream. So unfortunately, nobody will come out to say they are putting steroid in their cream. So even if they read the label, it won't be there. So that's the challenge we're having. People are being deceived by a lot of skincare vendors who claim they are creating organic creams and soaps, but they are using very strong chemicals. Then the last one is mercury. Now, mercury is not as common as before, but mercury, as we all know, has terrible effects on the kidneys, can damage the kidneys, can also damage, the brain and the nervous system, can even cause people to become depressed and psychotic. And after a while, I began to think that a lot of women that are having psychotic episodes as of lately, or unusual behavior, maybe we should do a study to see if they are using lightening creams containing mercury. And their behavior may actually be linked to, the creams they are using. Because we see a lot of people in the media these days having psychotic breakdown, and I begin to wonder if there's a correlation or an association. But it's possible. It's very possible. A study was done in India, and that study showed that all the women using mercury-containing lightening creams, they had some degree of neuropsychological disorder, ranging from anxiety to depression to suicide ideation. So it's actually possible. It's just that we haven't studied or we haven't looked at it in Nigeria. But mercury is also used for skin lightening. In fact, there are some soaps that are on the market today that still contain mercury. And I remember making a complaint on Twitter that why would agencies allow mercury-containing soaps to still be sold? So mercury, hydroquinone, and steroids, these are 3 major skin lightening agents that are used in creams, and people should avoid. Now, in Nigeria, 2% hydroquinone is acceptable for some lotions, a maximum of 2%. But we find that even some creams that claim they have 2% hydroquinone, when they were tested in other areas, they contain up to 10% of hydroquinone. So it's advisable that people don't even use anything. So what I tell people is that any cream that says whitening, lightening, brightening, glowing, fair, white, half cast cream, mulatto cream, gold, skin gold, any cream that has any of those adjectives, just avoid them, because you don't know what is inside them. And these people are not being honest about what they are using for these creams. So all this whitening, 7 days whitening, anything that will whiten your skin in 7 days is dangerous. It's harmful to you. And you should not, because you want to be fair, go and damage your internal organs, give yourself unnecessary complication. This is Nigeria, where we pay out of pocket for health. Very few people have health insurance, and even health insurance in Nigeria will not cover the kind of diseases that will come as a result of skin lightening, kidney related, I don't think there's any health insurance that covers such. You will pay out of your pocket. So it's best avoided, particularly for children. So I always tell people, yes, label or no label, in our environment, it is not really effective to look at the labels because a lot of people don't disclose what is in the cream properly. What you should just avoid is any cream that says it will lighten your skin, any cream that is glowing, fair, and so anything that has fair, anything that has white, as part of the name. Why do you want to be white? We are beautiful as we are dark skin. By the end of the day, if that is your choice, we cannot force anybody not to do it. It's a choice. But we must educate you about the possible risks to what you're doing. Just like alcohol. Alcohol is not good for you. People still drink it. But what we try to do now is educate people about, the possible risks of alcohol. Also, cigarette. You cannot arrest anybody who smokes cigarettes, but you must educate them about the possible risks to smoking.
Mm.
And that's what we'll keep trying to do as regards skin lightening. It's just so unfortunate that almost everybody wants to lighten their skin. Like, we're not proud of our dark skin. And, we hope that, we can just turn things around. I'm so happy that we have some kind of face of this fight now in Very Dark Man. And me as a dermatologist, I'm very happy. I am so happy that we have someone that is ready to call out people. We've been doing it, but we don't have, our voices are not as loud on social media. Because someone
Mm.
said, why are we not talking? Why are dermatologists not talking? We've been talking. But maybe because we don't have 1 million followers, our voices are not as amplified as they could be or should be. But we're happy now that somebody is championing this cause. Because the truth of the
Mm.
matter is, I think a lot of people are ignorant. They don't know. So maybe from this, from Very Dark Man's campaign against this, and the fact that a lot of people are complicit, who are benefiting off people's ignorance, we are happy that someone is calling them out. Personally, I am very happy. I'm happy about it.
When someone said to me that you guys are spoiling people's businesses that people need to feed, why would you come out and say this person should not use this product? Is it not business? It doesn't affect you. But from your own standpoint, Ma, as an expert, could you help us share some of the experiences you might have seen from people that use this product, your own experiences that were heartbreaking for people to know? Because I feel in this part of the world, we want to wait until it happens to us before we learn.
Okay, first and foremost, let me say this, and this is my own personal opinion. I'm not speaking for anyone. Anybody whose business is to benefit off the insecurities of another person is no different from a fraudster. What you are doing is you are profiting off somebody's ignorance and insecurity about their appearance. And that should not be your business. Even if you can create skincare products that do not lighten the skin, but make the skin healthy. And I think that is what Very Dark Man is trying to tell people to do. Why should this spoil your business if it is not, if your business is genuine, meaning that you are creating skincare products that, are good for the body? The only reason why people are objecting is because people are showing the side effects of this cream. How can your business, it's like feedback. If somebody is selling food, right, and they have a restaurant, and everybody that goes to that restaurant ends up in the hospital from diarrhea, from food infection, from, various problems, worm infestation, diarrhea over time, would you say that if people say they want to close down that shop, would you say that they are spoiling their business? This is now a public health concern because we are seeing people with the side effects of these creams. I saw a 20-year-old recently, 20 years old. Her skin was completely damaged. Damaged, beyond repair. The amount of striae, the amount of, stretch marks, the infection. She had like 2 different infections on her skin at the same time. And it's because of the cream she has been using. She has been using one Egyptian white, some kind of strange cream that I'm very sure it contains steroids because of how her skin was. And we have other people coming that you see them, young people, they have hypertension. high blood pressure, we cannot trace the blood pressure to anything other than the creams they are using. Then there was another person, she was about to have surgery, a young girl, and when they wanted to intubate her, her trachea was like paper. They couldn't intubate her because, it was tearing. And when we had to even study to find one of the side effects of steroid use, long-term steroid use, is something called tracheomalacia, where the trachea will become so thin, and it was a big problem because she needed surgery. So they couldn't intubate her properly. And the only thing, we searched up and down to see what could be the thing. The only thing that was obvious was that she was using skin lightening cream because she had all the dark knuckles and the thin skin and all that. So it's a challenge. And like I said, let's start checking as regards the kidney failure crisis that we're having in the country, whether it's associated with skin lightening creams or the use of mercury containing soaps and creams. I admit that we're not doing enough research, but if we do, I'm sure if we look for it, we'll find that there's probably some association here. But with every day, when I was just complaining to my colleague the other day that when I have a dermatology session or clinic, I want to see, as a specialist, I want to see cases, dermatology cases that I know I'm helping people solve their skin challenges. But these days, almost half of the cases are side effects of skin lightening. The people that really have serious dermatological issues, they are being pushed out because we have more people coming with side effects of skin lightening. And this is the reality. This is my own personal
Mm.
experience. So I feel like, in my DMs, I have people, because I do a lot of online consultation. I have people, they will come with florid tinea versicolor. That's what people call eczema. All over the face, all over everywhere is from the cream. And once they stop the cream, everything goes away. So it's a problem. It's a big problem. I really, really wish there was more regulation of these products and creams. And now we are now seeing the one of children. That's the one that is even making
Mm.
everybody to be so
Yes.
upset
Yeah,
that
that's where
this
I
one
even
that
want
you
to go
have
to now,
dragged
ma.
children into this problem again. You know.
Yeah, that's where I was going to right now. The area of mothers bleaching their kids. When we use the word bleach, what we hear is, no, I'm not bleaching, I'm toning, trying to bring out the color. And then we see mothers, you mentioned it before, they combine Formact A, they combine skin nails, so many substances in the cream to use on the babies. So together, what would you advise mothers to do with regarding cream for their babies? Then, for those that are bleaching their babies, what word would you have to tell them?
So the reason, like I said, is first to educate. A lot of mothers say when their children were born, they were very fair, and as they
Mm.
were growing, they started getting darker, and they feel that they need a cream that will bring them back to the color they were when they were born. And that is an ignorant approach. Children will be darker because they are in the womb. There's no melanin, there's no need for the melanin and in the womb, right? Because melanin, our skin color, is some kind of protective agent from the sun. Once they come out of the womb and their genetics, you have a dark parent, you have a dark skin parent, even if they are light, they will eventually change color. Do you understand? You cannot say that, for instance, the size in which your baby came out from the womb is the size that they should be forever and ever. They're going to grow, they're going to change. Their skin color at birth is not their permanent skin color, it's not going to be their permanent skin color. So people should stop trying to look for how to bring their skin color back to how it was when they were born. That's usually what these people that market these creams try to use to deceive mothers, telling them that, oh, has your child become dark? Because I've seen adverts like that on Instagram, on Facebook, and I'm like, this should be criminalized, for goodness sake. The child is going to get darker. If you or if the husband, the mother or the father are dark skinned, the child will get darker. Sometimes the child may be lighter than their parents. Sometimes the child may be darker than their parents. It is normal for this baby's color to change as they grow, and usually it becomes darker. Mothers don't need to maintain any color. The color will be maintained, or the color will come as the child grows. So I always advise mothers not to use all these new creams that are coming out for babies. Baby fair, baby glow, baby this one. Run away from them. Run far, far away from them. They are dangerous to these babies because we don't know what is inside these creams. There's nothing wrong with Vaseline, oh, good old Vaseline, the good old petroleum jelly, the good old baby lotion, you know, that is sufficient for babies. Is when people start looking for this glow maintaining color. There's one, and I will call them out, kids and teen, that they are using for small children now. I don't know what is inside that cream, but I suspect that it's steroids that are there, because a lot of children coming to the clinic, they use this cream, they develop tinea vesicolor, fungal overgrowth on the skin. And that usually is as a result of steroid. Steroid is an immunosuppressive agent. Babies and mothers they don't need to use Fombact A, Skinil, and all those tube creams for their babies. Those steroids are meant to be used for people that are 12 and above. There are different classes of steroids. The steroids inside most of the triple action creams that we have in Nigeria, there are class 1 or 2 steroid, very potent steroids, like clobetasol, like betamethasone dipropionate. Those steroids are contraindicated in children, except recommended by a dermatologist, and usually it's for a short period of time. But using those steroids for a prolonged period of time all over the body can actually shut down the internal organs of the child if there's, overuse of those products or those particular steroids. So we've said mothers avoid any cream, all these new creams. In my DMs, it's just that there's patient-doctor confidentiality. I personally don't post the pictures of my patients online. I don't. You will never see me posting any picture of a patient, who has come to me in my DM. There's confidentiality. I cannot do that. It's ethically wrong. But my DMs are full of people who come, especially babies. They've used all kinds of cream. There was one, she had used the cream. She had her babies. They were both they had so much of fungal overgrowth on the skin. Innocent children. And she showed me the picture of the cream she was using for those babies, a cream that is fair for a baby, for a child. I said, madam, please just go and throw this cream away. Just use simple. If you want to go, and I also say, people that are doing organic, if you want to do organic, do ordinary shea butter, do ordinary coconut oil. These are natural or organic, unprocessed, because organic is meant to mean unprocessed, is without preservatives, is without other agents that people are running away from. Not that there's anything wrong with these agents. Some of them are good. Yes, a few things like parabens and phthalates in recent times have been shown to be detrimental to the health, and a lot of bigger companies, cosmeceutical companies, are getting rid of such agents as preservatives. But I know that some people say they don't want to use anything that contains any preservative or any extra chemical, because they are afraid. But the ones they are running to, they are worse than what you are running away from. So if you want to do organic, just use plain raw coconut oil or shea butter, palm kernel oil, without mixing it with anything. You can't go wrong with that. I won't lie to you. It's possible to go wrong with it because sometimes they are not processed with the right type of water. The water may be dirty. There may be hygiene problems with those things. And that's the challenge we have with those things, that the processing and the storage may allow for them to be contaminated with bacteria, with fungi, and so many other things. So it has its challenges too. That's one reason why, we're like, okay, even if you're going to use these things, there could also be problems with them if they are not properly processed or stored. They can also have contaminants that can be harmful to the health. And you have to be sure that they have not been mixed with other herbs and things. So
things
yes,
inside.
so that's a challenge. But for mothers, please, please, and please, don't use any cream that says toning, fair child, light skin child. It's not necessary, because most of those things have chemicals that can damage the child's internal organs. And no mother will want to bring such damage or such harm to their own child just because they want their skin to be lighter or light skinned or whatever,
Yeah.
the case may be.
Now, for the medical professionals, what do we do with the proliferation of products on social media? How can we handle this? What would be your advice in this regard?
So for us medical professionals, I think our duty is just to continue to educate people online. I will continue to do that. I do that every day. I'm on YouTube, I'm on Instagram, I'm on TikTok. You are also on Facebook doing a fantastic job of educating people. But you see, this is a democracy and this is freedom. There's freedom of choice. You cannot force anybody. You can only try to educate them. But I feel a lot of people are fraudulent. A lot of the vendors of these products are fraudulent. And I feel that the only people who can do something about that, you know, legally are agencies, NAFDAC and what's the other one? FCPC.
PC, yes, yeah, yeah.
Yes,
Federal
those
Consumer
agents,
Protection. Yeah.
yes, Federal Consumer Protection Council, FCPC, and NAFDAC. They are the ones who have the constitutional authority and governmental authority to clamp down on people who are producing and selling unsafe skincare products online. And I think as much as possible, we should try to report to those agencies. Not everybody can do what Very Dark Man, in as much as what he's doing is fantastic. But we have authorities in the land. And as medical professionals, that is the only route we can take. I met someone who was saying, why haven't we done what Very Dark Man is doing? I said, our medical profession will not permit us to do things that way. But what we can do is to report cases to NAFDAC and report cases to the CPC if we feel that these products are unsafe for Nigerians. We can report and they should be able to investigate and do the needful. And then I always, ask people, medical doctors, dermatologists, keep speaking out. I'm grateful for people like you, people like Aproko Doctor, people like Dr. Kel, Health Athena, and Dr. Wale Ogunlano. There are so many fantastic doctors in the social media space. How I wish we had the following, more of us had the following and the influence as some of these influencers. Then I also want to the people producing these creams may be doing it in ignorance. It's because they are not trained. They are not cosmetic scientists. They are not doctors. They don't even know the side effects of the things that they are creating. They only know that, this thing can make somebody to be white in 7 days, and they're selling it. I don't know if they know that this can also cause very severe damage to the skin, whether they will still sell it. I'm sure some will still sell it, but a lot of them will not. So we have to continue to educate. And then when we see there is danger, report. And hopefully NAFDAC and FCPC will take up the fight and make sure that people selling harmful skincare products, are prosecuted or clamped down on. That's the thing. But I'm not sure if we can fight the battle that because MDCN has very strict rules And whatever we're doing, we have to do within the rules of our profession and, within the limitations of our, Hippocratic oath.
Mm.
So that's also very important.
Social media influencers, there are so many of them. I think they are not also helping us. We have a social media influencer with 3 million following, and a brand gives him or her a product to advertise. And the next thing we see, oh, this is what I use. This is the cream I use for my skin. I don't know if they would listen to us. Maybe they would listen to you. What advice would you give to social media influencers taking on these products and advertising it for them?
So I would want to appeal to social media influencers, celebrities, anybody who has a lot of influence. You have a reputation to uphold. It's not every job that is brought your way. It's not every deal that is brought your way that you should take. Yes, some of these skincare vendors, give them very juicy offers for them to influence on their behalf, millions and millions of naira. By the end of the day, would you want in the history books to go down for people to say that you were the one that influenced people to use a cream that shut down their kidneys or that made them to become diabetic or hypertensive at an early age or damaged their skin beyond repair? And the person will say it's because I saw it on this person's page that I bought it, because they claim that's what they were using. So I think a lot of influencers need to be very careful about what they promote. It shouldn't just be for money. A lot of people have come to me as a dermatologist to partner with them on their brand, and I've turned down a lot of them because I said, look, I cannot support a brand that does not follow due process.
Mm-hmm.
I'm not an
Mm-hmm.
influencer, I'm not a celebrity, but I have my reputation as a doctor and as a dermatologist to uphold. No matter how much you want to pay me, I will not take your money if I feel that your brand or your product is going to damage my reputation as a doctor. So I would also appeal for them to do the same, to try as much as possible to research. Or if somebody comes to you and is saying you should promote their skincare line, ask them, do they have NAFDAC registration? Ask them,
Mm-hmm.
do they have have their product been reviewed by cosmetic scientists, by dermatologists, and have been found to be safe? Because now lawsuits are coming. People are going to start getting sued, and even if they are not sued, their reputation will be tarnished by supporting or promoting products that have been found to be harmful. And the truth of the matter is that most of these influencers do not use these products. They don't use them. They have the products they use. But because those products, they are not paid to promote them, they won't promote them. They rather promote products that they are being paid to promote. And that is ethically wrong. I'm not judging them, but I would rather that, because now people's health is at stake, I would want to appeal to them not to promote products that would put people's health at stake. But then you look at it on the other side. Some people promote alcohol. Nobody
Mm.
comes for them.
Mm.
They promote
Mm.
alcoholic brands. And we all know that alcohol is not good for you. So, we also have to, at the end of the day, it's people's choice. We just need to educate. We cannot say don't promote it. They may know that it's damaging to the skin. They may still decide to promote it. Because just like alcohol and cigarettes, it's a choice. It's not illegal, but there can be a disclaimer that these products can damage your skin. Some people will still choose to use it regardless, but I would say let influencers also, have a conscience and decide if they really want to promote something that is harmful to the health. But at the end of the day, it's still a choice.
Ukbebo Joseph, he says, can one use cocoa butter cream and still get perfect skin color?
So, what is the perfect skin color? And why do you
Hmm.
want a perfect skin color? Because there's nothing like the perfect skin color. All skin colors are good. All skin colors are beautiful, and that's what we need people to understand. There's no skin color that is perfect, because whether you are as black, ebony black, like Lupita Nyong'o, you know, or you are as white as, who is a very white celebrity now that we know, their skin is beautiful, and the best skin is the skin you have. What you need to do is make sure your skin is healthy.
Mm.
And if you want a healthy skin, a skin that is healthy usually will have little amount of blemishes. There's no skin that is 100% blemish free. Even the most perfect skin once in a while may have blemishes. But what you want to have is minimal amount of blemishes, a good skin color, meaning that your skin looks a bit shiny, radiant, right? It doesn't have to be fair, you know. And that you can get first by eating the right food. Skin beauty is not just about what you put on your skin. It starts from your diet and your lifestyle. Eating fruits, vegetables regularly, drinking water, avoiding things like a lot of sugar, a lot of alcohol, a lot
Mm.
of salt, things that will damage you from the inside. That's the first step to having good skin. I always tell everybody, it's not by what you rub on your skin alone. You can rub the best cream, but if you are smoking and drinking alcohol and taking a lot of sugar, your skin is going to age and your skin will look older than it's meant to look. So it's not just about putting creams on your skin. If you want good skin, start by eating very well. And what I mean by eating well is not the quantity, it's the quality of your food. Make sure you eat the rainbow, have vegetables, fruits in your diet every day, drink a lot of water, make sure that you do not use too much sugar in your food. And then you can now speak about your skincare products. When you have done this thing, sleep regularly, sleep at least 6 to 7 hours every day. Make sure that you have good hygiene. Change your pillowcase, change your towels regularly. Okay. Don't bath too much, don't take too much of scrubbing or bathing. Don't use antiseptics which rub off your skin. Those things will help you to have healthy skin. Then, of course, using butters or creams depends on the type of skin you have. Some people have oily skin, while some people have dry skin. Okay, if you have oily skin, using a butter will be a bit too much for your skin. If you have and also your environment. If you have oily skin or you live in a place that is very hot, using a thick butter might be uncomfortable for your skin. And you may want to use something that's a bit lighter, like a lotion, which has less oil. So, like I said, there's no such thing as the perfect skin. Everybody's skin is unique, and your skin care should be regulated to the kind of skin type you have, not your color. There are a lot of people that say, oh, they are looking for cream for light skin, dark skin. It's a lie. The same cream that a white person can use, a very black person can use. You don't any cream that is saying they are making cream according to your skin color, they are most likely using a bleaching cream or a lightening cream, right? You don't pick creams according to your complexion. You pick creams according to your skin type, whether it's dry, whether it's oily, whether it's sensitive, you know. That's what you would inform the type of skincare product you use, not the color. Because a cream that is made for a white man can be used by an Asian man, can be used by a black man, or woman. Okay, so there are a lot of advertising gimmicks that are wrong, that are, they are kind of playing off people's ignorance. And we need to stop, we need to educate people about it. So with cocoa butter, it's a good cream as long as it doesn't contain any lightening agents. And someone with dry skin can use cocoa butter to help their skin to be better. But if you have oily skin, it may not be appropriate for your skin. So, but just remember that there's nothing like the perfect skin. But you want healthy skin that is not dry, scaly, that doesn't have a lot of blemishes or stretch marks or spots. Mhm. That is healthy skin, and that's what we should attain. We should try to achieve, not a perfect skin. Nobody has a perfect skin.
Nobody has a perfect skin. There is nothing like 100% blemish-free skin. Okay, good evening, doctor. There's this face cream I bought. I bought it as a seal and a code to send to confirm if the product is okay. which I did, and they confirmed the product. Hope such cream is okay. Uh,
Well, it's difficult to say because I don't know what the cream is. It's not about seal or no seal. It's about, the brand of the cream. Yes, there are a lot of people that seal their creams to prevent adulteration, But at the end of the
mm,
day, you want to be sure, what does this cream, what is it trying to achieve for your
yeah,
skin? And how do they market it? They market it as, for good skin care, for control. There are many good skincare products, many, many, but there are also some bad ones. So it depends on, how it is marketed. It's difficult for me to be able to say such a cream is okay when I don't know the brand, that you're talking about.
what else would you want to advise? What about the area of fruits and the skin? For those people that are trying to get a healthy skin.
Yes, fruits and vegetables I mentioned are very good to always be part of your diet. And fruits are better put into your mouth, not on your skin. Don't rub fruits on your skin. A lot of people will say they're putting lemon on their skin, putting tomato. In Nigerian sun, you have sunburn if you put those kind of things on your skin. You may see people doing it the abroad where they have less UV intensity. Please don't try it in Nigeria. You won't like what will happen to your skin. Anything that is meant to be eaten should be eaten. Don't put food products on your skin. What you need to put is look for good skincare products. Find out, are they developed with dermatologists? Are they developed properly? You know, are they also, what do they want to achieve? For instance, you may want to use something like a good cleanser, which is pH balanced, which I always promote. Moisturize your skin according to your skin type, where you can use a lotion, a gel, a cream, based on a paste or a butter, based on your skin type, like I've mentioned. Then there are things we call antioxidants, which are used for the skin. Antioxidants are very good to mop up what we call free radicals, which actually contribute to skin aging. So antioxidants will help to combat skin aging. Things like vitamin C, niacinamide, okay, resveratrol, ferulic acid. These are examples of antioxidants. Even retinoid, vitamin A derivatives like retinols, tretinoin. These are things that are good for the skin, but they must be recommended by somebody who knows about the skin.
Mm, mm,
There are also what we call hydroxy acids, which are exfoliants. Things like alpha hydroxy acids like glycolic acid, mandelic acid, lactic acid, then beta hydroxy acid like salicylic acid. These are agents that are made for the skin and can help you to have healthy skin. Then the most important, or not the most important, but one of the most important is sun protection. If you want your skin to age gracefully, if you want to avoid excess darkness of the skin, which is what drives a lot of people to use bleaching creams in the first place, use a sunscreen or use sunscreen creams. Sunscreen creams are creams that actually prevent the sun from, penetrating into the skin and causing hyperpigmentation and what we call photoaging or skin aging. So a good skincare routine should have a good cleanser, pH balance, a good moisturizer, antioxidants, and sunscreen. When you have those in your skincare routine, you have better skin. I will always advise people to meet a good esthetician or a good dermatologist to help you, to direct you on your skincare routine. You can actually get a dermatologist or an esthetician to create a skincare routine for you, not just any beauty expert online, because a lot of
mm.
beauty experts online are not trained, they're not knowledgeable about the skin. But if I would advise, follow dermatologists, follow good estheticians on social media. They always have free tips. They always give free, I always talk about free skin care tips and skincare routines on my page. You can learn how to take care of your skin from the cradle to the grave, from a baby to an elderly person. Follow the right people. Don't follow people that will lead you into a ditch. Then you start looking for Dermatologists are not cheap. Oh. Before you can see a dermatologist, it takes
At
time
all.
and also money.
Hmm.
Time, thank God in Nigeria, government hospitals, seeing a dermatologist is free of charge. Or well, you buy your card, but you won't pay so much. So if you come to
Yeah.
LASUTH, come to Luth in Lagos, almost all teaching hospitals in Nigeria have dermatologists. Also, you can see a dermatologist privately if you don't want to come to a teaching hospital, but you have to hold your
Yeah.
money, or if you have health insurance, your insurance can cover it. But try to see the right people. Don't go and see the wrong people, then come to the dermatologist to solve the problem, because you spend more money that
More.
way.
Yeah.
And
Yeah.
sometimes some of the damage done to your skin cannot be reversed even by the dermatologist. So it's better, as they say, a stitch in time saves nine.
It's
Try to
nine.
meet the right people to give you the right advice for your skin.
Is there any difference from organic cream, natural cream? Is there any difference? That word organic cream and natural cream. That is one. And then the other one talks about the use of antiseptic soaps. Do you understand? The use of antiseptic soaps to take bath. What would you advise in that regard? Because we have them out there. People just go buy antiseptic soap. So the first one is the difference between organic cream, the natural cream, and the antiseptic. Yeah.
Okay. So organic and natural, a lot of people use different names, right? When you say organic cream, it's meant to be unprocessed or raw, no preservatives, no additives. And that probably would be the same thing as natural cream. Like I mentioned, it's okay to use some of these products if they are properly and hygienically produced. The challenge is a lot of creams that claim to be organic are not organic. They
Mm,
contain other things in them. So it's difficult for us to say, yes, this is really an organic cream. Okay. So it's very difficult. Like I said, if you want organic, if you can produce coconut oil in your house, which a lot of moms do, and you're 100% sure that the oil you're using is just coconut oil, that you can go ahead and do that. But if you are going to buy, outside, and I don't know, it's difficult for you to be able to determine what you are buying in an environment like ours where anybody can sell anything without anybody checking that this is actually organic. And regards to antiseptics, I am an ardent, the English, sorry, I'm an ardent activist against antiseptic soaps. Go to my Instagram page, because there's not enough time for me to
yeah.
discuss extensively. But the the answer to that question is no. You do not need antiseptic soaps. Our body have good germs on them, good bacteria. They are protective. They are good for the skin. And when you take off those bacteria, you are distorting the normal functioning of the skin. And this can lead to a lot of problems on the skin in the long run. You don't need an antiseptic soap, because you need your healthy bacteria on your skin for your skin to function normally. Antiseptic soaps are
Mm.
usually prescribed for a short period of time for particular skin conditions, and then you stop. It's not something that you should be using every day, you know, particularly on children.
I
Don't
hope you
listen
got the
to the
answer.
adverts. Don't listen to the adverts. There are many adverts that push them, but as a dermatologist, I can tell you that you don't need antiseptic soaps. You are better off without them.
And for those that want to follow her, you can follow her on Instagram, you can follow her on TikTok, you can follow her on Facebook. She has so many videos there. I promise you, just go on that page and sit down. You will be grateful you did. I want to thank you so much, Ma. Do you have final words in 30 seconds for everybody as we disappear tonight?
Yes, my words are, everybody love your color. Your color is beautiful. All skin colors are beautiful. You don't need to change your color to somebody else. And also,
Hmm.
we advise advertising agencies, government, men especially, don't try to make one color to look like it is better than others. It is from our colonial past. But our black skin is beautiful, it should be embraced, it should be encouraged. And the more this is done, the less people would want to change their skin, or
Hmm.
change their skin color to someone else. But it's a part of human life. as white people are tanning, we are bleaching. So human beings generally are never satisfied, but I want to encourage people to be content with whatever skin they're in. Love the skin you're in and take care of it. Whatever color it is beautiful. Be content with your skin color and skin color of your children, and don't try to change it.
Try
We
to
are
change it.
here for
Thank you
you.
very
The
much.
masologists are here for you. But don't try to change your skin color. We can help you to make your skin the best that it is, or that it already is, really. That's the truth.
Thank you. Thank you. My